All right, so welcome everybody. Today, I guess start with the brief intro for me, right? That I've been doing this since 2000, went to school in 99. I have taught for like a decade. I worked on building a program for Fanshawe College. And in part of that, I've been head of massage therapy at Western since 2000. So the topics that I'm going to deal with today, I've been dealing with for the last 20 years. So the other aspects with me, like I've got like my background as well. I was a runner, track and field for 400 meters, made it as Canadian champion one year. So I got introduced to injuries and whatnot and how to care for them. So got involved with massage therapy afterwards. In that, I've seen a few things throughout, leading with Pan Am's as a lead medical professional there, and working with high caliber athletes. With that, today, one of the topics I picked was the triage aspect. And what brought me up to that was when we got this introduction to prioritizing our patients, working with the priority patients first and then moving on. If you read what I had put onto Facebook, I had some pretty good opinion on what I thought of that and how a lot of people were disqualified from it. I noted, watching some of the information coming out, that it would appear that triage is something that a lot of RMTs are not familiar with, and in essence lacking in their own assessment like bag, so they can pull it out and use a triage at some point. It is important, especially when we're dealing with trying to figure out how do we prioritize, who's our priority patient. This is, like I said, it's something I've been doing for 20 years. So I'm going to get right into the screen sharing here. There we go. Now I do believe everyone can see that one, right? There we go. Okay, so in triage, in Canada, we have the system set up for levels 1, 2, 3, 4, 5. Numbers 1 and 2, we're not really going to see much because that is resuscitation and emergent care. What that means, unless of course you're doing sport massage, and then you might see these, but what that means is that we're going to start with the 3, 4, and 5. If you are in a situation with levels 1 and 2, then what you're looking at is acting as a first aider. You're not an RMT at that point, you're a first aider. When we deal with levels 3, 4, and 5, now we're talking about working as an RMT and categorizing our patients by that care. This isn't something that a lot of people are familiar with because we work within a service industry for the most part, and we use that model more than we use like a triage medical model. Let me see here. So in a service industry, what I mean by that is that we basically see patients as they call in. There is no prioritizing when we see them, how we see them, why we see them. We just see them when they come in. But I'm going to throw in that, oh, I didn't want to go there yet. I'm going to throw in that we want to be able to prioritize our patients and give that, giving an appointment to someone who truly needs it and not making them wait if they don't have to. So going through this, I'm going to get to how we can incorporate it into massage therapy. But the basics of it is that we start with the history. It is military in origin. It was 1960s that triage was introduced to hospitals. In 1999, this 5-level category system was set up for a national guideline. So what it is in the National Emergency Nurses Affiliation definition is a sorting process utilizing critical thinking and standardized set of guidelines in which, an experienced RN assesses patients quickly upon arrival in an emergency department. 2, assess and determine severity of presenting problems, process patients into a triage category and streaming to an appropriate location, determine access to appropriate treatment, and effectively and efficiently assign appropriate human resources. One of the benefits of some of the benefits of triage is that you ensure priority attention to those most in need, establish acuity and anticipates resources needed, predicts how long the patient can safely wait, supports surveillance, and improves communication. So in the service model, we don't really use that first one where we give priority attention to those most in need, but it would be in a sporting situation where you maybe have a few people come up to you at once. But establishing acuity and anticipation of resources needed, when you're talking with your patients and you're trying to determine what modalities am I going to use, what other things, like say you're bringing in a stretching band, you want to use like laser, TENS, whatever it is you're using, you're helping determine this as part of our assessments. Predicting how long the patient can safely wait. This is important. You want to, when your patient is called in and they have some criteria, they're talking to you about how severe something is. You're going to try to determine, is this someone that can wait or is it someone who needs to get in like today? And if it is today and you don't have time or you don't have a space, you may need to refer them. And that's a colleague, to the emerge, to their doctor, whatever it happens to be. Supporting surveillance. Depending on how your patient is presented to you, you may want to follow up. You want to keep in contact how they're doing, what their outcomes are, what their needs are going further. And the improving communication part, simple. The more you know, the better you can talk with the patient, the better you can talk with other professionals in the circle of care. So when I'm saying how we can bring it into massage therapy, we already know how to assess. We can figure that one out. But when you do make that first call, when someone contacts you, you are doing triage to an extent. You want to know after they've called in, how soon do they want to get in, first of all, but also how soon do they need to get in? Wanting in and needing getting in is two entirely different things. Someone wants in today, great. Do they need in? Can they wait? Sure. Then you wait, you give them like 2 weeks, 3 weeks, whatever it is. But if it is someone who can't wait, again, you might want to make space. You want to figure out when you can see them and ask more questions. An email questionnaire and a website questionnaire is great for just weeding out people's priority and whether you're going to put them into what category, dire need or can wait. In this, some people do this in practice where you save a priority space. Dentists do this all the time, as an example. Your general practitioner does this, where they don't have someone scheduled. They purposely leave a spot for that priority patient. So if you have a spot in your schedule for your priority patient, you're able to get that person in who calls, tells you how bad things are, how they need to get in and see you. You determine that it is actually a need, you can give them that space. It is easier for you to get to them, get your assessment done, figure out, is this really dire? Is it something we need to take care of now? Your first assessment, I've got on there, be ready to wear your first aider hat. And do not assume you will be providing massage therapy at all times. So just because someone has come to you for an appointment, they've come to you for massage, it doesn't mean that you necessarily have to give it to them. That is a service industry thought, that someone's here, they've come in, they want it, they get it. But from a medical field, if you have determined that this person is not ready to come in, And this is something we took back to assessments that we learned at school. Be prepared to put on that first aider hat, act like one. Sometimes you may have to call an ambulance. Who knows? That's something you're going to have to determine by asking more questions. Okay? So be ready to go in any direction. Don't assume just because they're in that is what you're doing today. Okay? So ready to refer out, ready to confer with peers. If you work in a multi-clinic and you have someone to talk to right away, you can cut down on some of that time that you're triaging someone. Trying to figure out, can I see them today? Or even, do I need to send them to one of my peers who can do better? They can do more, okay? That, I'm also going to take back to the first one there where I said the phone in by the patient. When you're in a multi-clinic and different people you work with have different capacities, different abilities, and you know what they are. Just because a person is called in to see you, you might want to send them to someone else, depending on how they've answered you. Give them that ability that, again, it's for their medical, not just for you. So if they need to see someone who has that expertise, send them. Could be another RMT, could be a kin, could be a chiro, could be physio, could be the occupational therapist, whoever. Get them over there, refer them. Don't feel that you need to see the person just because they called you. And be prepared to let it go without any skin off your nose. Of course, I've used this one, the house approach to assessment triage. Everybody lies. And it's not that they lie to you on purpose. It's that you get things through omission. My favorite is when they say, I didn't think you needed to know that for massage. Get the information from them. Everyone keeps something from you some way, somehow. They don't always realize it. Now, obviously, when someone's being very purposeful and trying to lie to you, and I've had that happen where an athlete was having a concussion symptom, and he was lying to everybody that he didn't have it, just so that he could compete in his last Canadian Championship cross-country meet of his life. Once he got to the finish line, of course, now he's talking about all his signs and symptoms, and he should not have run that day. But he kept the information from us. Be ready to ask questions. When you see things, ask the questions. Obviously, at the end of the day, if someone chooses to not tell you everything, that's on them. But you'd want to do what you can to get as much information out as possible so you can make the right approach to it. You can determine what should I do. Okay. So obviously, in this one, I'm saying not all patients will be as bad as they say, and not all patients will be as good as they say. What I mean by that is when they come into you, so like that one who wanted to run, was saying he's not as bad as he actually was, okay? But you get some people in who will tell you that it's the worst thing they've ever experienced. It's their new 12 out of 10. You can tell by their demeanor that they're nowhere close to it. They're maybe like at their 3, but they just want in, so they're telling you that it's a dire need. Take the information that you're gleaning from them to determine how you're going to provide your assessment, and then triage as well. How am I going to provide therapy when, and how often, how soon? Send them away if you have to, or get them in quickly if you have to, based on what you determine, not just from what they say, but from what you have witnessed and, you know, the answers they've given to some of your follow-up questions. So looking beyond what they are saying, ask the probing questions. Don't be stuck on your basic assessment and taking face value out of it. If you feel that there's something more, yeah, be Sherlock Holmes, ask those questions, get to it, figure out the need they have, okay? The extended questions, basic. If you feel like you should ask more, ask more. Now, some of the things that make someone good at triage. So flexibility, be open to possibilities. That's where I said right at the beginning, don't expect just because someone came in for massage that they're getting massage. That's what you're doing today. Be flexible to any number of things that could be presenting. Be ready to react to it. Autonomy. Of course, this is one of the basics that we have, is that the ability for the patient to make their decisions. They're going to tell you what they want. Okay? They have that capacity. You don't take it away from them fully when it doesn't have to be. But part of your communication, discussing the findings, asking good questions, follow the breadcrumbs. You, by telling the patient what you're finding, can change their demeanor and what they want. So their autonomy has been augmented a little bit by more information. Communicate that to them. Discuss those findings in full. Assertiveness. So when you know what you know, don't let them talk over you. Lots of patients will do this. They will tell you that, you know, I don't care, just go ahead. Well, if you know that they have a contraindication, you are triaging them differently, you're sending them away, be assertive. Tell them, I can't massage you today because, and this is important in this world right now when we have people coming in and they have those signs and symptoms that indicate maybe COVID is something that they might have. We need to get it ruled out. We need to send them away. We can't diagnose that. If they show it, we send them away. Be assertive about that. If they want it, if the boss wants it, like in many clinics, someone doesn't understand what you've found, what you're trying to accomplish, and they'll make you feel like you have to do the massage today. You're the medical professional, it's your license, be assertive, do what you have to do. Patience. Of course, the patient needs time to process and be able to give good answers. That's where you just have to wait it out. You know what the answer should be, but allow the patient to process. Sometimes what you're telling them may be overwhelming. Be ready, let it set in. Part of that being the compassion. Be aware of how a person may be processing, especially when telling them they must wait. No one wants to hear that they can't get their massage today, but you need to be willing to tell them they can't get their massage today. And the willingness to listen, okay? You want to hear all aspects. Don't just ask questions, bang, bang, bang. Ask a question, hear it out, listen for that extra information that may be something that they're holding on to. Of course, diverse knowledge. The more you know about all the aspects of what can be going on, the better it's going to be. Keeping up to date on your first aid or even first responder information will really be helpful. Knowing when to act. Get in there. When you know something has to be done, get in there. So with dealing with like athletes again, you may have to, put one aside just to jump to the next because that's the action that you need at that time. Critical thinking, yeah, use everything you know to figure out what you're going to do. Able to make decisions quickly and also decisively, we'll say. This again goes back to not allowing necessarily for someone else to make your decisions for you. When you know that you have to do something, do it as soon as you know you have to. Don't wait it out. Make that decision, figure out what you need to do. And of course, the ability to prioritize. That comes with what we're told with our mandates there. Priority patients. So the next one after that would be the assessing beyond scope. So I'm going to just hit stop share there. All right. So to go a little bit further with that, I'm just going to pull that one up. So with what I do as a coach and as head RMT with the track team, the cross country team, I'm triaging a lot, and it will differ the day of. Anyone who's worked on a team environment knows that you may have 2 athletes, 6 athletes, like 12 athletes all coming to you at once, wanting, needing something. So asking the questions real quick, get them figured out, line them up where they need to be lined up. It is something you got to do quickly. In a clinic setting, it's not going to be as quick to do, so you do have more time to actually figure things out for someone and figure out where to put them. Okay. Let me see here. Yes, so some of the stuff that also comes into play. Our standards of practice are gonna be utilized here. So standard number 4, interviewing our client. You know, number 5, risk identification. Number 6, obtain, update, record client's health history. 8, determine client's condition by conducting assessment, reassessment. Determine if massage is indicated. And then, of course, discharging client. All these require a type of ability to do some triage and figuring out how do I prioritize, what do I write in there, like in the records, what do I do with this patient today, tomorrow? It all applies. I think at that point, yeah, any questions with any of this at the moment? Let's see here. There we go. So nothing in the chat at the moment here. Okay. So moving at this point with working with assessing outside your scope. What I mean by this is that we all do our assessments and we may come across someone who is determined to have a condition outside of that scope. There's certain ways people can work with it, and they do, and then there's others that have no clue what to do. So what I had at one point that really got to me about taking it too serious that you can't work out of scope, meaning that you can't assess out of scope. I worked at a clinic where I worked in MVA, and I got to see a patient after they'd finished their MIG. They got their first 3 months done, started in to see me. The very first thing this person started telling me was that they were having a lot of troubles because he witnessed or the aftermath. He was the first person on scene as a child after witnessing or after his father had committed suicide. This MVA brought back a lot. It invoked the PTSD. The physio who'd been seeing him didn't do anything about that. The moment I had it, I took him right over to the occupational therapist after asking some questions, and went to her. And we figured, we need to get this person into a psychologist, like ASAP, and that will help with advancing the treatments. When we went to the physio, he just put up his hands. He said, "That's not my scope, so I didn't want to do anything about it." I was like, yeah, it's not in your scope, but you've got to do something about it. You're not the one who's going to treat it, but you know someone who can. You know the profession that can. So we need to be very diligent about when we find something out of scope and it's something that needs to be taken care of, that we tell the person what our findings are, and we tell them which profession to seek, or bring another profession in with us. And when I say telling them what's going on, it's going to be a matter of giving a range, because obviously, again, we can't diagnose and we can't say this is the assessment. So it's the possibility thereof. So in this case, possibility of PTSD. Even though the patient was saying it was, who knows, it could be something else. But because it could be something else, it could be the PTSD that they've experienced before, whatever, I'm going to refer you to a psychologist who will actually figure that out, figure if something else is going on, if this is the only thing. Let it go. refer that person out, work with them afterwards, or concurrently if it is something that can be done. Let me see, another one here I dealt with very specifically. I had a patient of mine that started having a panic attack and had to get to the floor to settle himself down. And what he was telling me is that he couldn't move his body. He was stuck. But I'm watching him. He's moving his hands, he's moving his arms, he's talking with his hands. And he's telling me he can't move, that he's paralyzed. When the episode was over and he seemed a little more with it, we worked with it that he was going to get picked up by his wife that day so that he didn't drive home having just experienced that. But also I told him directly, he was a little more with it, he could handle it. I told him directly that his hands and feet were moving. He thought he was paralyzed from the neck down, but he was moving everything. So I indicated that there was a possibility of a psychological connection, that he was like not connecting to his own body that way. So I didn't want to see him in massage anymore because it was appearing that what he was seeing me for isn't something I could do at that point. I couldn't give him the ability to get rid of his like paralyzing feel when it appeared more psychological. Sent him to the psychologist. I heard back from him a couple months later after working through some stuff, and he asked me to get back on the team and work with the physical side. So communicated with the psychologist, we figured out a plan, went from there. And this is important, is being able to, again, let go of that patient, even if it is in the middle of treating them. If you figure something else out, you've assessed it, it's not in your scope, don't be afraid to send them away. Don't be afraid to let go and not be a part of their process anymore if that's not your, like if it's not in your capacity to be there anymore. But when you are, knowing what the other professions do is a great thing. So we have like 26 professions within the RHPA right now, plus we have some other like fringe professions. And with that, I'll say osteopathy, like manual osteopathy, because a lot of people are seeking that now. So figuring out that circle of care, getting in with them and working alongside your other professional. Okay, let's see here. Okay, so so with that, working with the profession. So stand your ground, first of all. This is a big one. When you are working with someone who's been assessed outside your scope, but is someone you can still work with, because there are like certain parts that are within your scope, you want to stand your ground as the therapist that you still can decide treatment plans, whatnot, even though there's something else in there. The biopsychosocial is a big thing right now, the word we like to use, that connecting the body and the psychology. So in order to do that, we can't be the ones who determine the psychology. That's not in our scope, but it's within our scope to treat someone in the biopsychosocial way. What helps is having things figured out, having actual names to things, assessments, diagnoses that you can then work with. We can't determine someone has anxiety disorders. Can we work with them? Yes. We can't tell them that's what that is and then start treating for it. But once we get something back from another professional who says that is what it is, well, now we can read the notes, figure out from that other professional maybe what things would be useful, get in there and start treating alongside that other professional, now using that information that has been determined by someone else. This will happen with a lot of things, not just the psychology, but different injuries as well. So like post-surgical, you're not going to get a like you know, a note from the doctor that releases them from like any harm or whatever, but because you can, it's still up to you to figure things out on your own, but working with that professional to figure out what did they find and what are some suggestions of theirs that could be useful. Okay. We can then incorporate those things into our treatments, and also figuring out when, like asking the questions, when are you doing certain things with your patient? What is your progress plan? I'll make a plan around that. So especially say post-op, what is the plan with the physio, with kinesiology, with seeing the doctor? What are their plans that I can now work with? Doesn't mean I have to do what they're doing, but working alongside them, knowing what they're doing, and then making what I add in useful and not detrimental to that patient. Use your circle of care. And circle of care means that you don't necessarily need the patient's okay to talk to one of their other professionals. The circle of care allows you to talk with other professionals that you know are in that circle of care, meaning someone they are seeking treatment from right now. You can talk to them. You don't need that letter from them. You don't need anything that says that you're allowed to. The patient can take away that and tell you they don't want you to talk to someone, but you can talk to them because it's circle of care up until that point. You don't need to run around. When you want to talk to the doctor, call the doctor, send an email. Get some information from them. Until it's been removed by the patient, you are free to contact anyone in that circle of care that you know is in that circle of care. If it's someone that's not one of the RHPA recognized professions, that might be where you want to put in place a form for them to sign, because that person, even though they're in the circle of care, they're not an official medical professional. So it is useful to say, like, I'm going to share medical information with someone that is not a recognized professional. Is that okay with you? Otherwise, if they're in that RHPA recognized field, your circle of care allows you to then work with them and beyond that, essentially beyond the scope. So you're still working in your own scope, but there are certain things that you've gotten from the other professionals that you can now use to enhance what you're doing that was kind of beyond. So again, psychology, not ours to determine, but we can figure out what to do with a diagnosed condition. Okay. At the moment, that's, yeah, I'm going to open it up to some questions on some of that. So anyone out there with any questions so far with what we've gone over? All right. So I'm not seeing any questions coming up, so I'm assuming everybody's absorbing this information and doing well with it. Let's see here. So that's the meat and potatoes of what I have there for you guys.
Huh? Hello?
Hello? Hi there, I can hear you.
If you have a question for Chris and you're
wanting to talk there.
if you have a question for Chris and you wanted to get it out to him, you can just make sure you unmute your microphone.
All right. So Diane, I see you're unmuted now. Did you have a question? I cannot hear anything, but you are unmuted, Diana, if you intended to.
And if you're having difficulty with your microphone, you can always ask your question in the chat box.
All right, no questions on there. So really, a lot of the other stuff. Oh, here we go. Any examples of the website or email questionnaire questions to prioritize patients? I don't have one per se that I've got made up. A lot of people do have stuff built in, like the different apps and whatnot do have questions and answers that automatically the patients can utilize. You want to change it up according to what you do. So your demographics, depending on where you are, the type of patients that you might see, you might want to add a couple of questions to it, or even delete a couple if they don't pertain to you. But let's say like a question being like putting on your level of pain. What is your pain level like at today as you're trying to book this appointment? Is it a 1? Is it a 10? Like, what are you telling me? Something as simple like that can tell you whether it's someone that you want to call back right away and be like, okay, so you put down 10, so what is your 10? Tell me what's going on. Why is it so dire that we need to get you in? And let's see if we can accommodate you. Those questions for prioritizing someone, yeah, you should be able to add them to the apps that are available, like the different software out there. But otherwise, create one with Word that would be appropriate to you that you can then send to patients when they leave their information, including the email for you to get back to them. But like, yeah, the simple thing of not just when do you want an appointment, but how is your pain today? Is there like dire need to get in to see me? Do you want me to call you back? Those sort of things that can come into play. All right. As far as any specific questions, I can work with you and come up with some to put into place for you if that's what you want. Does that answer what you're wanting there, Tamara? All right, so yeah, if there's any more, like, feel free just to send to me. Is my screen share still up right now?
No, just your camera.
Okay, just the camera. Okay. I'm gonna give you this. There we go. So there's my direct email as well for any questions or whatnot. So just write it down, have it there. And yeah, so I don't have a template at the moment, but it's not something that's too difficult for me to come up with if you'd want an example of some things to have ready for your patients. So I can definitely set that up. Yeah. Any other questions out there? Okay, I'm going to take that off of there. One of the things, like for, I'm going to say with triage, even with the referring out, something I'm going to suggest, it's going to be very important for us moving forward with all the information we have these days to really look at taking a mental health first aid course. A lot of stuff comes into play that wasn't there like years ago. Even in the traditional first aid, we don't have the information that is necessary for helping all our patients out. I had a situation a few years back that I didn't have the specific training for, but watching, knowing what was going on, knowing my patient, she had a, what was determined, she had 2 psychotic breaks while in my clinic space. At one point, I even got the sense that she wanted to bite me. And she was crawling on the floor and saying to me that she was telling her brain that I wasn't a danger. And at that point, what I did was I called the ambulance and told them that I had someone who was having an episode. I need someone out here at my clinic. And then I just observed her. She didn't really go anywhere. She wanted to, she was trying to crawl, but she couldn't move. So I just stood back, watched her, in they came, great. What I found out afterwards is that, of course, there's too many people that right away in a situation like that where they think they're going to be bit, they're going to be like hit, they're going to be scratched, whatever. Their first response is to call the cops. In this sort of situation, it is important to recognize that this is a mental health issue and that calling an ambulance, calling EMT is much more beneficial to that person than calling the police. Even if the police are super compassionate, they don't have the ability to transport that person correctly. They have a small space in the back for people to sit, and that confined space can also work against someone who's having a mental health issue. Instead, the ambulance came, they actually, because I told them it was mental health, they sent in the emergency response guys who did have the training and were ready for it. They worked with her, got her on a gurney and out to the ambulance, no problem. Recognize these things, know what you're dealing with. Triaging, working out a scope, like they are important aspects of what you do, and it's important to know that you can do them. Know who to call, who you want to send the person to, whatever comes into play. Okay? The more confident you are with it, the better you're going to incorporate it into your practice, the better you're going to work with people to get what they need and to get them what they need when they need it. Someone who needs to see you now, but they put it off and they wait the 4 weeks because you didn't ask, you said the next available time is 4 weeks. And then you're seeing them saying, why didn't you go to someone else? That means you didn't ask the right questions, or the questions weren't available for that person to find out what is their need. Not just what do they want, but what is their need. Be ready to ask it, be ready to refer, be ready to even get someone like in to see you. If you have to spend that extra hour today working, or in some cases, do you have a patient that can be bumped? Someone you know that isn't in dire need will work with you so that you can put in a patient that has more need. Don't be afraid to do those things. It is within your capacity as a medical professional, not just a service provider, but a medical professional, to make those choices and to determine what can I do with this patient and how can I accommodate them. All right. All right, if there is nothing else there, then yeah, I'm ready to wrap up. So
I think you have one more
any other questions?
that popped up.
Say that again, Mark.
I think there's one more question that might have popped up.
Okay. On the chat. There we go. Mental health first aid course. They're really like new to the scene. So like St. John's, first aid course companies, like they'll have them out there. And essentially like what'll be good is someone who's been doing it long enough that they've got more information available for that. So the St. John's right now is pretty good because they have been doing it for a bit of time and they've educated themselves on how to do the mental health first aid and get you in a position that you're comfortable with it, so you can recognize what you're seeing and how to work with that person. Okay. Like was being talked about, even like with concussion earlier, someone may have like an altered perception, that thing where they think that they've lost memory, but they haven't. Recognize that, talk to them about it, and what do I need you to do because of it, right? Like, you can share that information when it's not going to damage them to know it. Part of what is going to be taught with the mental health first aid is that as well, making sure not to tell someone in certain states information that is actually detrimental to them. Share it when it's, a better time, or with the next medical professional that should hear it. All right. Any others? All right, Ashley, let's see. So yeah, that's where, along with like dentists is really the best one to say with that. So when you're offering priority patient time slots and you're worried about some sort of burnout, you can even do to the point where you're going to only give that time slot away to someone who has presented to you as dire need. And this is where standing up for yourself, exerting yourself, and being secure in what you're doing. Don't give it away to just anyone. If that is your break time and helps you to avoid your own personal burnout, leave it open. Don't feel the need that you have to fill it if there was no emergency person call in. Have it as an extra space for you to use. It is your extra break that week, but it's available if someone calls in and needs to see you now. And even that time, like if that person is in such dire need that all you're doing is an assessment to then tell them when you want to see them next or which professional to go see. That time slot, again, doesn't have to be massage therapy. It can be just assessment for that day, and then telling the person, okay, I'm going to need to see you like soon, so let's book you in on Monday, or this is actually something that it's not as bad as you're thinking it is, so we can wait. I've got something in 3 weeks, I think that'll work for you. Okay? So don't feel the need, that if you're going to set aside that time, don't feel the need that it has to be filled. Only have it as your priority patient. The one who comes, like calls in screaming at you that they've done something, they really need to see you, like, they pulled their hamstring, they like fell, they were in a motor vehicle accident, and you're just going to do that quick assessment. At the very least, you're going to do the quick assessment and then nothing else. Don't give it away to someone who just, tells you, I've got time, it's my lunch that day, can I get in? It's not priority. So save it for yourself. Your career is more important than seeing that one more person, because if seeing that one more person every week, or those 2 more people every week, will lead to your burnout, that means you take a long career to a short career, and you don't do yourself any favors, and you don't do your patients any favors, because your career is shortened, but also that patient loses an RMT they've come to trust sooner than they should have, all because you pushed to fill those slots that you were leaving for important things. Only the priority patients. Okay. All right. Anything else?
I think that was pretty good, Chris. Thank you very much. So this is what we're going to do. We are going to have to refresh the Facebook feed. So if you're viewing on Facebook, the video will stop after this presentation, and then we're just going to refresh the feed. So you're just going to have to jump back on and watch the new one as it comes up. And the next presentation will be happening at 2:30. So if anyone has any questions for Chris, you can always go to the Con Ed Facebook page and leave some comments in this original, this first video that's up, this live, that is going to be left on our Facebook page as a video, and you guys can continue the conversation there.
All right, thanks everybody for tuning in. I'll be there. I'll interact where we can and get as much answers to the questions that might come up that I can offer you. All right, so have yourselves a great day, everybody.